Simplified explanation. The extrinsic pathway of apoptosis starts when a signal comes from outside the cell and binds to a special receptor on the cell surface, called a death receptor. There are two main death signals. Fos ligand, Fos-L, binds to Fos receptor, CD95. Tumor necrosis factor alpha, TNF-alpha, binds to its receptor. These interactions activate caspases and start the process of cell death. This pathway is important for the immune system, especially in the thymus, where T cells are tested. If T cells react too strongly to the body's own tissues, they are eliminated using this pathway. This process is called negative selection. If there's a defect in the Fos-Facil interaction, harmful T cells are not removed, and the person may develop autoimmune lymphoproliferative syndrome, ALPS. This condition causes enlarged lymph nodes, enlarged liver and spleen, autoimmune attacks on blood cells, cytopenias. USML Question 1. A patient is found to have a mutation in the Fos gene. Which of the following outcomes is most likely? A. Reduced protein synthesis in lymphocytes. B. Impaired destruction of self-reactive T cells. C. Decreased cytokine production by macrophages. D. Overactivation of B cells in the bone marrow. E. Enhanced mitochondrial cytochrome C release. Correct answer, B. Impaired destruction of self-reactive T cells. Explanation. Fos-Facil binding is needed for deleting T cells that attack the body. If Fos is defective, these T cells survive, leading to autoimmune disease. Why not the others? A. Protein synthesis is not the main issue here. C. Cytokine production is unrelated to the Fos pathway. D. Fos works mainly in T cells, not B cell overactivation. E. Mitochondrial cytochrome C release is part of the intrinsic pathway. USML Question 2. A 6-year-old child has chronic lymphadenopathy, hepatosplenomegaly, and a history of autoimmune anemia. Genetic testing shows a defect in Fos-mediated apoptosis. Which of the following conditions is most consistent with these findings? A. DiGeorge syndrome. B. Autoimmune lymphoproliferative syndrome. C. Common variable immunodeficiency. D. Wiskott-Aldrich syndrome. E. Severe combined immunodeficiency. Correct answer, B. Autoimmune lymphoproliferative syndrome. Explanation. ALPS is caused by defective Fos-Facil signaling, leading to failure of T cell deletion. It presents with swollen lymph nodes, large spleen and liver, and autoimmune blood problems. Why not the others? A. DiGeorge syndrome involves T cell absence due to thymic issues. C. CVID involves low immunoglobulin, not Fos defects. D. Wiskott-Aldrich includes eczema, bleeding, and immune problems but not Fos mutation. ESCID shows severe infections from early infancy, not autoimmunity or lymph node swelling.